The perfect therapy song for the next guest. You've got a friend, Dr. Katherine Pannel. Good morning. How are you, ma'am? It's good to have you.
Hey, good morning.
You've got a friend. I'm sitting here reading your masthead on the on X. Mississippi physician, past board chair, MSMA, BOT. Have no idea. What is BOT?
Board of Trustees.
MOMA, MPA, AOA, and AMA, alternate delegate, author, fierce mental health advocate. That'll throw you into therapy trying to keep all of that up together.
All of the abbreviations, yes.
Hey, number one, I kudos to the people in Ridgeland, the Mayor McGee, and everybody else for one of the things that we want to talk about, and that's making a decision about kratom. You want to speak to that?
Yeah, I was really encouraged and excited. I do wish that the legislature would step up and just go ahead and do a statewide ban, but I'm proud of all these cities and counties that are taking it upon themselves to get rid of it, get it off the shelves. They're seeing the dangers, they're hearing about the overdoses, and they're taking action, and I love to see it.
Because number one, I think in the last few years it's become stronger, and we have no idea what's with kratom in there.
That's right. That's right. Because we're seeing it on the gas station shelves, it's being touted as a supplement. And so it's not even gone through the FDA, the rigorous testing to assess safety profile or anything. So, no, you really don't know what's in the kratom, but we do know that kratom itself is addictive and deadly. So,
isn't there some kind of category we could do as far as the legislature? Because some of the stuff is synthetic, right?
Most everything we're seeing on the streets right now is synthetic. Yeah. Doctors prescribing, mid-level prescribing, all of that has gone down year to year to year. We've seen reduction in prescriptions for like opioids and other things. But we're continuing to see rises in overdoses. So, it's definitely a problem with synthetic pills, opioids that are on the streets right now. It's not prescription diversion.
Well, it would probably be the question a lot of legislators are asking, trying to prepare for 2025. Mm-hmm. Is there a category or wording we could put in law that says any of these mind-altering drugs that do this shall be prohibited for sale? Whether it's
I think we also. Right, we've got to get ahead of it. I feel like we're just chasing our tails. We're trying to put like I always say, put the toothpaste back in the tube. What we need is a clearinghouse where before any of these gas stations can put anything on their shelves, they've got to be looked at and cleared to make it to the shelves. As you said, anything that's supposed to be mind altering, mood altering, they have to be. I think we need a screening process before they get there.
There is, it's easy to pick them up, so I'm not even sure why you would decide to go through the mail to do this when you can have them delivered or pull up to any convenience store and get this.
Exactly.
But the dark web is another place. I was watching a show the other day, and man, there's some nasty stuff on that, and it's beyond my comprehension how to stop that. But even if we do stop, the convenience stores, it's still going to be out there.
Mm-hmm. Mm-hmm. That's right. And it's coming dark web, it's coming across our borders. And that's why the real emphasis has not been on decreasing the supply, because we've not figured out how we're going to do that. It's what we've put emphasis on is decreasing demand. And that's through prevention and, talking about it and having the conversations. SuperTalk has played a huge role in Mississippi to continue to talk about these substances and the risk of them and the risk of death. Reducing the stigma, just making it a normal part of conversation.
Tomorrow is, International Overdose Awareness Day?
It is.
And it actually is an international awareness?
It is. And normally when I come on here, you ask me about numbers and I'm doom and gloom, and our overdose rates are increasing, but provisional numbers for 2023 actually look like we are going to see a decrease in overdose deaths for 2023. And again, I think that's a large part and due to just all the effort to put on prevention and education and then harm reduction. I think all of those things together, we're finally seeing the benefits from the work.
I can't believe when the kids don't know this, certainly in college, when they see a pill that's not labeled or they get it somewhere other than from their own sources, they even dare to take that road. They got to be scared to do it, unless you're just dead drunk and you pop it without thinking. But
Yeah, exactly right.
Are fentanyl cases down also?
Yes, and we even saw that in 2022 in Mississippi. Fentanyl overdoses have decreased. And which is wonderful. I mean, that's what we wanted to see. That's what we worked for. But sadly, now we're seeing overdoses on other things increase, like stimulants and cocaine.
Stimulants. What are we talking about? Stimulants.
Those are things like the methamphetamines, Adderall, the things that are more mood elevating.
Yeah. In many times they're doing this in combination of alcohol, of course.
Absolutely.
So what are we talking about as far as approaching our strategy for the 2025 legislative session? Any bills or anything like that you're going to be working on?
Yeah. So, and we've talked about this, and you and I multiple times on this. It seems like once we get something under control, like it looks like we're finally making some headway with fentanyl, something else pops up. The nitazines and then xylazine. And, it took a while for us to be able to get fentanyl testing strips decriminalized. But now, because of these new things popping up, we need to be able to test for those too. And right now, legislation is only for the fentanyl testing strips. We need to go back in. Chris Bell had an excellent bill, 1090, House Bill 1090 last year that died, that basically just gives us the availability to test for all these new things that continue to pop up without us having to go in and write new legislation. It just basically opens it up to test for whatever we're seeing that's out in the community that's causing harm.
Dr. Katherine Pannel, has Narcan played a big part in this?
Oh, huge part. And kudos to the legislature for this, for allowing community organizations now to actually access the Narcan and be able to distribute it. I know there's a couple things happening right now in Oxford in preparation for International Overdose, where students can actually come in, access Narcan, and be taught how to use it. So the big thing is we're getting Narcan in people's hands, and that's what we're seeing saving lives. Of course, we want to prevent any, ever getting to the point of an overdose. But now at least we have the availability to use Narcan freely, so that if you're in that situation, you know how to reverse it and save lives.
When you, and I've had this conversation, it's been quite a while ago, with someone who says, look, this is back when marijuana was going to be voted on. Kratom to them was something that was a lot cheaper, and you could get it at a gas station. Marijuana was going to be highly, it's going to be processed, but it's also going to go through all of the taxes and everything else. It costs them. They got to go to a doctor, et cetera, et cetera. And if you try to explain to them the vast difference between the two, you kind of get lost in there. So when somebody says, I'll just go do the Kratom, forget about the marijuana, what do you say to them?
I mean, basically, you're going to another form of addiction. Kratom is still unsafe. I mean, even though there's this misconception that it's not, because it's on convenience store shelves, it is not safe. It is still addictive, and it can cause death and overdose. And it behaves just like an opioid. It works on the same receptors. It causes respiratory depression and death. It's not safe. So you're not choosing something safer. You're just switching addiction, essentially.
Yeah. But at least you have your physician's blessings to do it.
Well, not with Kratom, thank goodness. Now that would be great.
Medical marijuana.
Oh well, yeah, and we're not. I mean, like you said, the medical marijuana is expensive and it's tedious to get. So it's not really decreasing any kind of marijuana use. People are still going to the streets, and we all know that marijuana can also be laced with fentanyl, and it's also so much stronger than it used to be. So I don't see that medical marijuana is reducing any kind of addiction to cannabis.
When you look at someone with trying to withdraw from Kratom, have you had people in your therapy for that?
So I'm outpatient, so I don't necessarily do the detox for it. I can do a few things to make it comfortable, but the addiction to Kratom is so strong that we are now seeing patients have to go into detox facilities to be safely detoxed, because it's just like an opioid. You're detoxing from opioids, and it's miserable. And so we're seeing an increase in admissions to detox facilities for Kratom.
Really? What's some of the side effects of this?
So are you talking about for detox? It's just like with you.
Kratom.
Yeah, so you're going to have that increased heart rate. You have horrible GI cramps, diarrhea, sweating, diaphoresis. I mean, it can cause your vitals to go wacky. So, I mean, you have to be monitored. It's a miserable process, and that's why it normally fails in an outpatient setting. I mean, I can offer that to patients and give them the opportunity, but they fail it and either go back to kratom or have to go into more an elevated level of care.
How long do you have to be on? How long can you be on it before before becoming addicted to it? Is it usually?
I mean, it would take months. 5 or
6 times. Months.
It would take months to develop that physical dependency, but once you're dependent, it is really, really hard to get off.
Amazing. Can you hang on for a second?
Absolutely.
Dr. Katherine Pannel will be back with more. Kenny Prince joins us, author and former game warden, coming up at 8:05. Stories about this whole immigration thing. Is healthcare from mental to physical that's going on in some of these sanctuary states? They can't handle it, whether in school, from some of the kids and everything else. And luckily, it hasn't been that big of a situation in the state of Mississippi yet. Dr. Jennifer Bryant, she's the current. That was a question I was going to ask. When do you take over for the Mississippi?
So I'm currently president-elect. I'll become president next August.
From her next August.
Correct. Yes.
I got you. Do you see? And just a couple of other questions here. When we talk about the next legislative session coming up in January, do you see the issues with the hospitals, the rural hospitals, being as urgent and dire as they were in the last legislative session? Do you think that's going to calm down a little bit?
I don't think it's going to calm down. I think it's going to, again, really be a big topic with the legislature and how we fix the situation and find solutions for sure. I think it's going to be a big topic again, and a big topic for the state medical as well.
What's your thoughts as far as finally getting something done as far as CON, Certificate of Needs?
So we definitely do. Something has got to be done, and especially in the mental health realm, we do need more beds. And I think that the CON is burdensome. It gets in the way of us being able to provide mental health services that we desperately need.
Let me get your final thoughts before we let you go. I know you're a busy lady, and I got a feeling that you may be going to a ball game soon.
I am. I'm going to the opening Ole Miss football game tomorrow night.
Well,
Hotty-totty, go Rebels.
Yes, absolutely.
Yes.
You get your weekend plan. Your final thoughts.
Just let's keep talking about all things mental health, all things substance use. We're doing a great job in Mississippi. We're seeing overdoses fall. And again, I think a lot of that is due to just the ongoing conversations that we're having, breaking down the stigma, communities getting involved through medication assistance, Narcan, prevention, education, and just again, thanks to SuperTalk, you're a huge microphone for mental health issues, substance use is in our state, and just thank you. Always a pleasure to be here and to talk about these things.
Thank you, ma'am. Appreciate it very, very much, and be careful this weekend.
I will. Have a great weekend. Thank you.
Thank you, Dr. Katherine Pannel. We'll talk to Kenny Price, and that is coming up at 8:05.